starting with the very first question, in which a 19-year woman is brought to the emergency department 8 hours after intentionally ingesting 30 tablets of paracetamol. She is asymptomatic except for mild nausea. Liver function tests are currently normal. What is the most appropriate management? So, going with the keywords first, the lady has ingested 30 tablets of paracetamol and she presented after 8 hours. Okay. Now, clinically she is asymptomatic. Asymptomatic means she don't have any symptoms. Except for mild nausea, and liver function tests are also normal, and specifically one word is written currently. It means at the time being LFT is normal. Now what to do? Now here many students, they think that the patient is not having any problem, LFT is normal, then we need not do anything or simply wait and watch. But this approach is wrong. Even though the patient is asymptomatic, LFT is normal, still we should not forget that the patient has consumed 30 tablets of paracetamol, and sooner or later these tablets will produce the effects. So better start or give antidote to this patient. An antidote for paracetamol poisoning, I think everyone must be knowing, it is N-acetylcysteine. Okay, so this is N-acetylcysteine. Fine, and just basic effect of this, it will restore glutathione reserves in the body, right. So, even though the patient is asymptomatic, LFT is normal, but we need to give N-acetylcysteine since the patient has consumed 30 tablets of paracetamol. Okay. So, that is very basic question and one of the favorite questions which has been repeated over the years. Now, moving forward to next question, a farmer presents with salivation, lacrimation, diarrhea, meiosis and bronchuria after pesticide exposure. The antidote that reverses nicotinic manifestations is. Now, again we can write the keywords. The patient is a farmer, right, and he is exposed to some unknown pesticide. So, there is some unknown pesticide poisoning, and now let us see what are the manifestations. There is salivation, lacrimation, then bronchuria, diarrhea and meiosis. So, what does this mean? Salivation means increased saliva production, lacrimation means increased tears production, bronchuria means increased bronchial secretion, diarrhea increased gut motility, and meiosis means pupillary constriction. Clear? So these are the manifestations, and almost everything is increased. Now this is the classical cholinergic overactivity, right? And when I say cholinergic, it means acetylcholine is acting too much. So increased cholinergic activity. Now what could have happened? Now before that, we can take a basic physiology thing. Acetylcholine is acted upon by one enzyme, and that enzyme is known as acetylcholine esterase, right. So the name of that enzyme is acetylcholine esterase. So this enzyme breaks down acetylcholine. Now what happens? This pesticide inhibits acetylcholine esterase. Now what will happen when this will not work? Obviously the level of acetylcholine will increase. That's very basic concept. So the enzyme which is needed for breakdown of this, if that enzyme will not work, acetylcholine will increase, and therefore we will see increased acetylcholine activity. Okay, so this is what has happened here. Now what is this pesticide which is inhibiting acetylcholine esterase and resulting in overactivity of acetylcholine? That is organophosphate. So this is a case of organophosphate poisoning. Clear? So this is organophosphate poisoning. Now the question is asking about the antidote which has to be given to reverse the nicotinic manifestations. Now obviously the pesticide is inhibiting this enzyme. So we have to stop this inhibition so that acetylcholine can degrade acetylcholine, because once the acetylcholine is degraded, the effects will also come back to normalcy. So we have to stop this inhibition, and this is inhibited by, so antidote here is a class of drug which are known as acetylcholine esterase reactivators. Clear? So these drugs are known as acetylcholine reactivators, acetylcholine esterase reactivators, because when they inhibit this effect of organophosphate, acetylcholine esterase is free to act, and then it will degrade acetylcholine. Now what are the members in this group? The classical member is pralid oxime. Okay, so this is pralid oxime. So the answer to this question is pralid oxime. Now we see here that there is acetylcholine overactivity. So some students might say that, sir, why shouldn't we give atropine, that is anticholinergic? Because overactivity of acetylcholine, we can give anticholinergic, that is atropine. But here the question is specifically asking about nicotinic manifestation. So this one is for nicotinic receptors on which atropine has no effect, right? So that's why our answer to this question will be pralid oxime, which is an acetylcholinesterase reactivator. Atropine is also valuable in organophosphate poisoning, but with respect to nicotinic manifestations, it doesn't have much activity, because atropine acts on muscarinic receptors, right. So, that is why this is the twist in this question which you should remember. Next question. A 32-year-old man is found dead in his room. Post-mortem examination reveals rigor mortis present in jaw and neck muscles, but absent in lower limb. Post-mortem lividity is not fixed. The most likely time since death. Now, for this kind of questions, you must be knowing the different time periods for different post-mortem changes. So, let us try to solve this question. So, what are the keywords given to us? Rigor mortis is present in jaw and neck muscles, okay, jaw and neck muscles, but hadn't reached up to the lower limbs. So, it has started, but it hasn't reached up to lower limbs. Then secondly, post mortem lividity is not fixed. So, there are two post-mortem changes which are given to us, rigor mortis, that is stiffening of the body after death, and post-mortem lividity, that is hypostasis after death. Now, here the rigor mortis starts somewhere after 1 hour, and post-mortem lividity it fixed somewhere after 6 to 12 hours of death, right. So, it means this is after 1 hour, because it has started, but hasn't reached up to the lower limbs or the facial muscles. So, it has started, it means the time has already crossed 1 hour mark, but this is not fixed, it means it hadn't reached up to the 6 hours state. So, somewhere the time period since death is between 1 hour to 6 hour. So, it is somewhere between 1 hour to 6 hour, clear, because it has crossed beyond 1 hour changes, but it hadn't reached up to the 6 hour changes. So, after 1 hour, but before 6 hours. So, this is the usual, this is the time period as per this particular question. So, 1 to 6 hours, because after 6 hours the post-mortem lividity will start fixing, and since the post-mortem lividity hasn't fixed yet, so it means it is before 6 hours, and since the rigor mortis has already started and progressed, so it means it is beyond 1 hour. So, that is how, if you know the time frame of different post-mortem changes, then only you can solve these kind of questions. So, slightly difficult for students, I do agree with that, but this is how you should approach such questions. Okay. Then next question, a body recovered from a closed garage shows cherry red hypostasis, most likely poisoning. Now, this is the one which has been very frequently asked, and every time they give you a different scenario. So, here closed garage, this is number 1, and number 2 cherry red hypostasis or post-mortem lividity. Now, when the word is closed garage or closed room, or sometimes if the person is sleeping in a car, closing the windows. So, whenever there is this kind of environment where there is no circulation of the fresh air, this has high possibility of accumulation of carbon monoxide. Clear? Carbon monoxide. And this carbon monoxide poisoning, if the patient dies because of carbon monoxide poisoning, we see cherry red hypostasis. Clear? So, this is very classical for carbon monoxide poisoning. Sometimes the question is like family members during winter, they turned off the stove and they slept with the rooms and the door and the windows locked. In that scenario also carbon monoxide poisoning will come. So, any mention of any closed space followed by the death of a person, think of carbon monoxide poisoning. Okay? That is how you should solve this question. Now, next question, a victim of burns gives a statement identifying the assailant before dying. Okay, so what is happening here? Victim, okay, so if we write the keywords, there is a victim who is about to die, right? And what is the cause of death? Burns. Now, what he is doing? He is giving a statement, and a statement about what? Who killed him, means who set him on fire. So, the victim is giving a statement about the person who is responsible for his death. Now, which is true? So, now what is true for this case? Now, if we go with this scenario, this is dying declaration. Clear? So, what is this? Dying declaration means the victim is telling someone who is nearby to him that such and such fellow is responsible for my death. So, that is known as dying declaration. Before death, he is giving a statement to anyone related to the person behind his death. Now, here the important thing is that it is admissible even without cross examination, right. So, cross examination means the other party people are putting questions forward. So, there is no cross examination, whatever he will say that will be taken as the truth, presuming the fact that if someone is dying, he will not lie. So, that is dying declaration. So, person is giving statement, and this statement can be recorded by anyone. Okay, this statement can be recorded by anyone. There is no need of oath, and it carries less weight medico-legally, right. It carries less weight medico-legally when we compare it with dying deposition, right. So, this is in short about dying declaration, and here there is no need of any cross examination. Yes, so just remember that. Now, next question, a 28-year-old woman is found hanging from a ceiling fan. On autopsy, the ligature mark is situated above the thyroid cartilage, runs obliquely upward towards the mastoid process, and is incomplete posteriorly. Salivary dribbling is noted from one angle of the mouth. What is the most likely cause of death? Now, this is a very beautiful question, and it has been repeated many number of times. Now, what is the keywords here? And this is especially about the ligature mark. So, let us take the features of the ligature mark. How is the ligature mark? It is above the thyroid cartilage. Okay. above the thyroid cartilage, runs obliquely upward towards the mastoid, and lastly is incomplete posteriorly. Clear? And then there is one more important point, dribbling of saliva along the angle of mouth. Now, this point is very characteristic of antemortem hanging. It means the patient was live before he did suicidal hanging. So, this is antemortem hanging, means patient was live, he put the noose on the neck, then he jumped, and then the ligature led to asphyxia, and the patient died. So, that is antemortem hanging, and the dribbling of saliva suggests that there is stimulation of the salivary gland. So, there is overproduction of saliva, and that dribbled along the angle of the mouth. So, that is antemortem hanging, and these three points also suggest hanging. Clear? So, this is a classical case of suicidal hanging, right. So, this is very important. Above the thyroid cartilage, oblique and incomplete. These three features of the ligature mark goes in favor of hanging, right. And dribbling of saliva, it tells that it is antemortem hanging. Okay. Next question. A soldier is found dead holding a revolver tightly in his hand immediately after death. What is this phenomena known as? So, what keywords we can see here? Dead soldier, right, and then revolver held tightly in hand. Now, what is this known as? Now, before that, suppose if the muscles are not in a state of activity at the time of death, usually what we see, that there is an initial relaxation phase, right, and after this the muscles will go into rigor mortis, stiffening of muscles after death. Now, this is usually happening, but sometimes if the muscles are in a state of activity, means the muscles are working, and if the fellow dies, then the muscles straight away goes into rigor mortis, and this relaxation phase is absent. So, that is very important. If the muscles are in a resting state, they will relax and then they will go into rigor, but if the muscles are working, they will directly go into rigor and there will be no initial or primary relaxation phase. And this condition is known as cadaveric spasm. This condition is known as cadaveric spasm, also known as instantaneous rigor. Means the muscles are directly, instantly going into rigor mortis without that primary relaxation phase. Now, in this question we can see that the shoulder was using the pistol or revolver. So, it means the muscles of the hand are in a state of activity and therefore, they will directly go into rigor mortis. Similarly, sometimes what we see, if a person is accidentally drowned into a pond or a river, he might have some weeds in his hand, and that suggests that at the time of the death the patient was trying to save himself. So, the weed, he was using his muscles of the hand, and the weeds, they came in the hand, and instantly after his death the hand muscles, they go into rigor, they become stiff, and the weed remained within the hand only. So, that is again a classical example of cadaveric spasm or instantaneous rigor. Okay. So, please remember this beautiful concept. Then burning, blackening and tattooing are seen around a firearm wound. What is the range of fire? Now, this is very important question, firearm injuries, and many times we have a question in which some features are given and then they will ask you, what is this? Close shot, contact shot or distant shot. Now, in this particular question, what keywords are given to us? One is burning, another is blackening, right. Now, these 2 points can be seen in contact shot, or these 2 can also be seen in close range gunshot. Means either the weapon is touching the body or either the weapon is close to the body but not touching the body. So, it can be seen in both. Now, how to differentiate? In contact shot, there are some extra findings. One is muzzle imprint. It means as the weapon is kept close to the body, so there will be the imprint of the muzzle end of the gun. So, muzzle imprint. In close range, additional finding will be, so I will write additional here. So, plus additional finding will be tattooing, right. So, if you have tattooing, go for close range. If you have muzzle imprint, go for contact shot. So, this is how, despite having these common findings, the differentiating clue is tattooing, and therefore, the answer to this question will be close range, right. So, this is how you should solve such questions, and it is all about keywords. Search for the keywords, mark your answer, go ahead, no need to do unnecessary analysis of the question. A patient dies in a house fire. Which findings proves burns occurred ante-mortem? Now, ante-mortem burns. Ante means before. This is A-N-T-E and not A-N-T-I. Ante-mortem. Mortem means death. So, it means the patient was, or the victim was alive before being burnt and then his death occurred, right. So, at the time of burns he was alive and he was trying to save himself. Now, out of all these features, there is one important feature which suggests that yes, the patient was alive before dying because of burns, and that is soot particles in trachea, because this suggests patient or the victim was breathing then only the soot particles can go into trachea. Otherwise, it's very difficult to push to send the soot particles in trachea. It can only go if the patient is doing some respiration, right? And if the patient is doing respiration, obviously he was alive before dying because of burns. So that's a classical indicator that yes, patient was alive before being burnt. Because sometimes what happens, somebody can kill a person and then can throw him in the fire, and then they can claim that it was burn, he died because of burn. So in that case, when we open the trachea, we will see there is no soot particles. So that will confirm the fact that this is not an antemortem burn, it is a post-mortem burn. It means the person was killed by some other method and then thrown into the fire, and the culprits, they were trying to misguide the investigator. So that's very important. Antemortem burn, soot in respiratory passage or trachea. Now, most reliable bone for gender determination or sex determination, this is pelvis. So just remember that. Now, a patient has hyperpigmentation, hyperkeratosis and transverse white lines on nails. What is the diagnosis? Again, we can write the keywords. One is hyperpigmentation. Then second is hyperkeratosis, but the third one is classic transverse white lines on nails, right? So the moment you find this transverse white lines on nails, this is a classical case of arsenic poisoning. Clear? This is a classical case of arsenic poisoning, and these lines are actually known as Eldrick-Mees lines. Right? So these are Eldrick-Mees lines, and hyperpigmentation we can see raindrop pigmentation. So this is raindrop pigmentation. So this is about arsenic poisoning. Remember, transverse white lines on nails, Eldrick-Mees lines, very suggestive of arsenic poisoning. Then a battery factory worker develops anemia, wrist drop and bluish gum pigmentation. Which poisoning is suspected? I think this is also a very straightforward question. So the person is working in a battery factory. Now he had anemia, wrist drop, it means the wrist falling down, and bluish gum pigmentation. Out of the three, this one is very classical, bluish gum pigmentation. And I think the moment you find this, this is also known as Burtonian line, right? So Burtonian line, it is seen at the border of the teeth with the gums, and this is classical for lead poisoning, which is also known as plumbism. Clear? So the list of the symptoms is very big. There may be basophilic stippling of RBCs, there will be facial pallor and all, but for the time being, just remember bluish line over the teeth gum border, think of lead poisoning, and that is actually Burtonian line. The next question, a farmer develops ptosis, diplopia, dysphagia and respiratory paralysis after a snake bite. Local swelling is minimal, most likely snake type. Now this is very commonly asked, every time we have a question about some snake bite, or the features of the snake will be given, and then you are supposed to identify the snake. So here let us write the keywords first. What is happening? Ptosis, diplopia, dysphagia, and respiratory paralysis. Now, ptosis means drooping of upper eyelid. Diplopia means double vision. Dysphagia, difficulty in swallowing. Clear? And then the local swelling is minimal. Now these effects are seen after bite of which snake? Now here what we are seeing, the mostly the features are neurological. Clear? The features are neurological. Ptosis, diplopia, dysphagia, respiratory paralysis. So this is classical of cobra venom or cobra bite. Clear? So cobra or crate, they have their venom produces neurological effects. So here it is all about cobra. Then next question, most characteristic feature of antemortem drowning. Again, the patient was alive, he drowned into the water and then he died, right? So this is antemortem drowning, and the classical feature is fine froth at the mouth and nostrils. This is very classical for antemortem drowning, and even if we wipe it, the froth reappears, right? So even if we try to remove that froth, it will come back again. So that's fine froth at the mouth and nostrils, and that is very classical for antemortem drowning. It means the patient drowned in water, but he was live before being dead because of drowning. Clear? So this is classical antemortem drowning feature. Then a conscious 17-year-old boy requires emergency laparotomy after trauma, but parents are unavailable. Now, what are the keywords here? The age of the child is 17 years. He is conscious and he requires emergency surgery. Laparotomy. Laparotomy means opening of abdomen, and most likely he must be having some internal bleeding. That's why the abdomen has to be opened. But the problem is that parents are not present in the hospital. They are unavailable. Now, from whom we should take the consent for surgery? So this is the question here, because the child is not grown up enough to give a valid consent. So in such cases, since the doctor has to go for emergency surgery, he can't wait much, so he can proceed under implied consent. So the patient has come to him, he need emergency surgery, so it will be presumed that the consent has been given to do life-saving surgery, right? So this is implied consent. Then a man drinks illicit liquor. After 24 hours, he developed blurred vision, severe metabolic acidosis, and optic neuritis. Best antidote. Now, what has happened here? Patient has taken illicit liquor, right. So, history of illicit liquor drinking, and after this he developed blurring of vision, optic neuritis, and severe metabolic acidosis. So, what happens when someone takes illicit liquor? There is consumption of, you can say, methanol, and from methanol there is formation of formic acid, and this formic acid can lead to visual disturbances in the form of blurred vision or optic neuritis. So, what we need to do? We have to give an antidote. So, antidote for methanol is ethanol. Clear? So, ethanol is the antidote for methanol. If ethanol is not there, we can also give fomepizole. Clear? So, ethanol is the antidote for methanol, else we can also give fomepizole. So, this is the answer here. Okay. So, this is enough for this session. I am very sure you must have enjoyed the session. Thanks for joining. Stay blessed.